Buongiorno, good morning to everyone in this section. I am Alberto Torresin, I'm a medical physicist. I'm working in Regione Lombardia in Italy, Milano, and Alessandro Scardoni is my reference person. The Directorate General Welfare of the Regione Lombardia is a public authority responsible of the planning, governance, financial and regional healthcare system. And the population of our region is about 10 million citizens. DG Welfare oversees the organization of welfare and social care service, particularly the coordination of the hospital and the clinical network. The stroke network is our interest in this case. But in general, emergency care, prevention, territorial care, and so on. We have a very large budget, it's about 20 billion. And DG Welfare uses the healthcare network as a tool for interconnecting different healthcare facilities and experience in our region. Stroke, to tell the truth, is the cause of a lot of clinical problems that we have in our region. And we have this, this problem is a general problem all over the world, but we need rapid diagnosis and treatment. This is the clinical outcomes that we need to increase with this project. We have an organization in a lot of hub and spoke network in the local region, because the spoke are connected to specialized hospital with the rapid consultation, image sharing, and access the advanced treatment. The number is about 11 hubs and 40 spokes. We did in this network, we have a delay of cross-hospital imaging access, fragmented system, lack of standardization, advanced stroke assessment, and complex hub-spoke coordination. This is the reality of our experience, but I think it's a general reality. And what our needs and objectives? Enhancing stroke diagnosis with and using ISO, artificial intelligence driven CT analysis, enable faster and more accurate spokes decision making. And we hope in this case to improve the regional stroke coordination. And what is the current state in the procurement process? We needed to address and we start in this environment in November 2024, the project, the clinical application in stroke management for emergency and interpretation of stroke CT scan. The project is currently in the pilot implementation phase of an artificial intelligence-based stroke imaging solution delivered under the InnoMatch program, and in parallel, Spin4AC support Regione Lombardia in the procurement process. The scope is to find the innovative solution in the narrow real world, in reality of hub and spoke setting, because it's very important. Sometimes in the spoke doesn't exist experience in neuroradiology, high quality diagnosis level, so that the hub exists, but it's very important to reduce the time of the decision for what is the best solution for the patient. Second step is in implementation. Pilot include baseline assessment like IT integration, clinical training, workflow testing, KPI monitoring, and final evaluation. Final evaluation, it means to evaluate the pros and cons of the solution in the reality to verify what is necessary to do in the next future. The last step will be the procurement perspective. Pilot design to generate real-world evidence, inform future OMC, and call for tender. This is the project phase. Assessment, pilot, implementation, open market consultation, call for tender, and contract in the next future. Technically, I have only one slice for this aspect. We need this workflow. Stroke incident, CT scan in the emergency department, storing the data into the PACS, to send the image to the stroke team through AI solutions after analysis of the images and able to support the discussion. It's possible to share imaging and discussion with different profile, different person of the hospital, with the stroke team particularly, and to decide what is the best solution for the patient. To be fast is very important. What are the expected benefits? Secure connection, image transfer, user authentication, analyze stroke imaging. And what I said is important to support the radiologists in the spoke who often lack specific neuroradiologic expertise. It's possible to increase the discussion between clinicians, radiologists, neurologists, technicians, in a certificate way to define the current clinical solution. This is very important because sometimes the connection by phone, by email, in this case, the AI solution is able to be a very specific network for discussion. Using mobile technology, it is possible to facilitate remote working because neuroradiologists are not necessarily in the hospital. They are around, but they are open to be called. Store all the decision-making step, optimizing clinical decision-making process. Interdisciplinary work is mandatory. This is very important experience for our side. What are the lessons learned? The innovative procurement application in stroke management for emergency interpretation carry out as far as providing valuable insight into how to structure test and scale innovative solution and innovative procurement to address a pressing public need, improving procurement planning, reducing procurement risk, supporting evidence-based purchasing decision. And the key lessons are the following: faster, early cross-functional engagement, procurements, clinicians, and IT, to enable the translations of innovation into scalable procurement contracts. Second step is align pilot timeline with procurement planning, ensuring that results are available in time to inform tender design, budgeting cycle, and internal approval process. Finally, approaches innovation procurement as a progressive learning process. It's not plug and play, but we need the time, we need coordination, and using the pilot is able to build knowledge, test assumptions, and shape tender strategies before full-scale procurement. use pilot-based validation to better understand the market, reduce procurement risk, and generate real-world evidence to support values-based procurement decision. This is important so that in our project, the pilot is the first step to verify the pros and cons of the activity to prepare what is the best solution for the clinical network of the stroke. Because at the moment, there is not the perfect doesn't exist, but the possible to increase the possibility to reduce the time of decision of the clinical people involved in the stroke. Thank you. Thank you to Federico Lubner that we discuss this presentation, and I am open to the questions. Thank you.
Thank you very much, Alberto, and congratulations to the whole Lombardy team working on this pilot. It sure will have a lot of impact in the region. So I remind the audience that you can post your questions for Alberto in the Q&A box. And meanwhile, Alberto, I would like to ask you, what have been the biggest challenges that you've encountered so far? And any recommendations on how to address those also for other buyers here?
Yes, the main challenges that is not easy because it's not easy in general to put together different profile in the project or in the reality at all. Is the real world of day by day. But the main, not critical, but we have to solve, for example, the signing the document of the general director for the impact of decisions is one aspect, because general director is the final person that must to sign not only the document. Is not bureaucratic, is to have the consensus from the organization, from the budget, to start this project. And it's important to not to spend time, to have the right way to inform the people about the project. This is the first one. The second one, the main important aspect is the system configuration. Overcome with the collaboration of the people involved in the project with different experience in different center, because there is medical doctor, informatics, medical physicist, administrative that authorize the activities. And finally, the management of privacy and data management, which required sharing with the data protection officer, who often do not have adequate awareness of the importance of the project. But the bilateral meeting are able to a tool for solving problems. But this is a very critical aspect, because we need to guarantee the GDPR activity. We need to approach the activity in the field of GDPR reference field. And this is another aspect that we have to solve, to approach correctly and in the right way.